Hello, I'm Erin Lee, and I'm really happy to present today on an indoor air quality pilot study completed in childcare centers. I work as a research coordinator at the Medical College of Wisconsin in the Children's Hospital Allergy and Asthma Clinic, and I'm the executive director of our local asthma coalition called Fight Asthma Milwaukee Allies. Additionally, I'm working on an EDD at the University of Wisconsin-Stevens Point. The principal investigators on this project include Dr. Steinberg, who is an allergist at the Medical College of Wisconsin and the VA, and Dr. Dressel, who is a sustainability professor at the University of Wisconsin-Milwaukee College of Nursing. She also is quite active in the West Lawn Partnership for a Healthier Environment. I also want to acknowledge our funder, the Clinical and Translational Science Institute of Southeastern Wisconsin. They provided us with $50,000 to do this one-year pilot project. We are located in the state of Wisconsin, and this map zooms in so we can see all of the county outlines. We hail from Milwaukee County. The city of Milwaukee population within that county is just under 600,000 people. Currently in the state of Wisconsin, there are about 400,000 adults with asthma and about 100,000 children with asthma. This graph is showing how the prevalence of asthma has a strong association to income. The bar on the far left-hand side is showing that the smallest annual household income of $15,000 per year or less is associated with the highest asthma prevalence at 18.7. And as that household income gets higher, the asthma prevalence gets lower. Here we're looking at hospital use by age in the state of Wisconsin. The top line of bar graphs is showing hospitalization rates, and the bottom line of bar graphs is showing emergency department visit rates. Each line of graphs is divided into clusters by age ranges, and in each cluster we're seeing the males, the females, and then the combined number. We were interested in this cluster of age ranges from 0 to 4 years old, and you can see that in that age group, hospitalization rates and emergency department rates are higher than any other age group, and this is for the state. We also know that for the age group of 5 years and younger in the city of Milwaukee, hospitalizations are 2 times higher than that for the county of Milwaukee. And also in that same age group of 5 years old and younger for the city, emergency department visits are 1.5 times higher than that for the county. So childcare became an environment of concern. It has been shown that indoor air quality can be 5 times worse than outdoor air. And Americans spend a lot of time, up to 90% of their time indoors. So preschool children here in our country spend a lot of time indoors too, often at their childcare center. Previous studies have associated IAQ with wheeze and the development of asthma. And childcare IAQ has been understudied, especially in comparison to primary schools. Furthermore, Wisconsin childcare centers have unregulated IAQ. Neither the EPA nor the state of Wisconsin regulates IAQs in childcare centers. With those background statistics in mind, we developed several project aims. First, to describe what the air quality is like in childcare centers. We didn't know, and we couldn't find any other data on this. Second, we wanted to assess factors that might be causing or contributing to indoor air quality in those childcare centers. And third, to teach a green cleaning class to childcare staff and see if that learning would impact the IAQ. 36 childcare centers participated in a 4-month project. At enrollment, air quality monitors were installed to continuously collect data on particulate matter, size 2.5 micrometers, total volatile organic compounds, carbon dioxide, really as a measure of ventilation, temperature, and relative humidity. Also at enrollment, childcare administrators completed a pre-survey that was repeated at the end, and all childcare centers received gift cards for participating. The 36 centers were randomized to receive either early education or late education. They received continuing education credits for attending the 1-hour green cleaning program, and a satisfaction survey was completed at the end of the class. This is what the indoor air quality monitor looks like. It's a consumer-grade validated monitor called a FUBOT that's about the size of a small water bottle. In this next section, I'll review the educational messages of the green cleaning class. There are several infographics that I have shared in the session resources. However, you will have a chance to download each of them via QR codes that are embedded on the screen. So if you prefer to download directly to your phone, you have some time to make your phone handy if it isn't already. The first factor being measured by the FUBOT was particulate matter, which is a mix of particles that are suspended in the air. There are two sizes designated, either 10 micrometers or 2.5 micrometers, measuring diameter of the particle. This strand is an enlarged image of a human hair, and the blue spheres show the size of PM10 in relation to the hair. There are 5 PM10 particles that fit across the width of that hair. The pink spheres show the size of PM2.5 in relation to the blue spheres. And you can see here where 4 pink spheres are fitting across the width of one of those PM10 blue spheres. PM is so small that it can float in the air like this dust does. And it's also really easy to breathe into your lungs. The PM2.5 is so small that it can get into the smallest airways and even into the bloodstream. The health effects of PM2.5 are well documented. Exposure commonly causes eye, nose, and throat irritation and can worsen symptoms of heart or lung disease like congestive heart failure, asthma, or COPD. Exposure has been linked to premature death, and we know that children and older adults may be at greater risk of negative health effects from PM. So where does the PM come from? The sources are really anything that burns, like candles, heaters, tobacco smoke, stoves, fireplaces, chimneys. Anything that burns can create the smallest PM2.5 particles that can really get deep inside of your lungs. So to minimize PM2.5, these are some of the checklist items that we were teaching in our class. Limiting the use of candles and small heating devices, maintaining a no smoking policy inside, venting cooking exhaust to the outdoors or opening a window if there's no exhaust fan, maintaining the fireplace flue and yearly furnace and chimney inspections. Also important are regular furnace filter replacements and regular cleaning, damp dusting inside of the building to reduce the dust levels. The second factor being measured by the FUBOT was volatile organic compounds, or VOCs, which are gases that come from many common products that we all use. VOC levels can get concentrated inside buildings and may reach levels that are 10 times higher than the levels found outside. Health effects of VOCs are really kind of a long list. The most common ones are dizziness, headache, and nausea. Others include coughing, nose, throat, and eye irritation, skin rashes, general fatigue. Health effects generally vary by person and what specific VOC they're exposed to and how long they were exposed to that VOC, but some VOCs can cause cancer. So what are the sources of volatile organic compounds? There are lots of sources. So candles and smoking, perfumes and nail polish, bug repellents, furniture really made of that glued together particle board, the chemicals used in dry cleaning, ingredients in laundry detergent and clothing softener, disinfectants and household cleaners, as well as air fresheners, paints, solvents, and varnishes, glues, markers, and all kinds of different DIY project materials. So a really long list of sources of VOCs. On this slide, I'm naming 3 problem VOCs because the list of VOCs is just too long to put on one slide. So you may have heard these names. Formaldehyde is classified as a carcinogen, and it's in many common products like nail polish and cosmetics, household cleaners, paint. Benzene is another carcinogen, and it's found in tobacco, different kinds of fuels, and car exhaust. And toluene, there's not enough research to label this as a carcinogen, but it's also very commonly in paints and paint thinners, different kinds of adhesives, and in printing. So our checklist in our educational program for minimizing VOCs contained recommendations like limiting the use of those products that contain VOCs, maintaining a no smoking policy inside, being careful about following labels, especially any safety recommendations, buying only as much as you need and then using that quantity as completely as you can, using green or DIY cleaners out of very safe ingredients, and then regularly cleaning and damp dusting inside to reduce the dust load in the building. Our green cleaning education began with this list of the terrible 10 cleaners. They are listed in order from the most harmful, starting at drain cleaners, to the least harmful, ending down with the liquid cleaners. Most items earn their spot on this list because they contain either ammonia or bleach. Have any of you accidentally mixed ammonia and bleach together? It creates a chloramine gas that's actually related to the mustard gas used in World War I. It's kind of a yellowy, smoky gas that makes you start coughing. We've had reports of people coughing up blood. When you breathe in this chloramine gas, it can be very damaging to tissues and can result in death. If you take a picture of the QR code on the screen, you can download this infographic on the terrible 10 ingredients. We focused on transitioning to safer cleaning recipes, starting with the most harmful from this list, using up what you may have already purchased, and then little by little switching to new cleaning recipes. The Fantastic Four ingredients that we recommend are the safest because we use them in cooking, meaning that we all add these ingredients into foods that we eat. All of these are environmentally harmless, and each has slightly different cleaning roles that you can see on the slide. Baking soda removes odors, lemon juice is antibacterial, and vinegar acts as a disinfectant. If you clean with these, and not all of the cleaning mixture is rinsed off of a surface, that residue will not be harmful to young children or pets that might touch the surface, then put their hands or paws into their mouths. Here is the safer list of ingredients that, while safer than the terrible 10 products, would not be good to eat. Borax is naturally mined and is used to deodorize, and has disinfectant properties. Hydrogen peroxide is antibacterial, and tea tree oil has antibacterial, antifungal, and antiviral properties. Washing soda requires the most care from this list, and when mixed with water should only be handled while wearing gloves. These safer ingredients should all be stored with care, where children especially can't get into them. This QR code will share the ingredients list infographic for safer cleaning. Both the Fantastic Four and the safer cleaning supplies are listed on this infographic. Vinegar spray is the first basic recipe that I'll share. Simply mix equal parts water and vinegar and it's ready to use. It's super easy to take your spray bottle, fill it halfway with water and then the other half with vinegar, and it's ready to go. If you do not like the smell of vinegar, which actually dissipates quite rapidly, you could add lemon juice or other essential oils to mask that smell. The vinegar spray cleans smooth surfaces that don't need scrubbing, like mirrors, windows, and countertops. Also, the vinegar is good for wood furniture, flooring, and cutting boards. Another QR code here will link to our vinegar infographic, which is kind of like a recipe card for that vinegar mix. The second basic recipe is cleaning with baking soda, which is good for surfaces that require scrubbing, like the ring around the tub. For this recipe, you'll need a storage container with a lid, and then simply mix the box of baking soda with 4 tablespoons of liquid soap and enough water to make it a paste-like consistency. Another QR code here will link you to our baking soda infographic with all the steps to make that recipe. In our green cleaning education, we also focused on safe use of bleach because bleach itself is one of the terrible 10 ingredients since it is a severe respiratory irritant for all humans. However, bleach is the main sanitizer used by childcare centers. The dilutions up on the screen that we recommended followed the state of Wisconsin requirements for use in childcare centers, which are more conservative than general directions. We focused on being mindful of the measurements and what level of dilution is being used for which kinds of surfaces. Do notice that more bleach is used for cleaning non-food contact surfaces. Essentially, much less bleach is used in the mix that will be used on food contact surfaces. So childcare staff should be mindful of keeping those 2 kinds of bleach dilutions in separate spray bottles.
Lots of marketing going on in this aisle. Fancy labels, slick designs. This one's got flowers on it. It's pretty. After the stomach flu ravages my home, am I supposed to believe that an ocean breeze is going to blow it away? Please. I know what clean smells like. Bleach. The same bleach that knocks down dysentery and cleans up crime scenes. You want to spend $3 on liquid doubt? Be my guest. You want clean? Get a cleaner with bleach in it. Clorox. Bleach means clean.
That video really highlights the marketing competition that safer cleaners are up against. Since our project was not in a place to challenge guidance communicated by the state, we focused on safe use. So this QR code takes you to the bleach infographic that shows spray bottle size dilutions for both food and non-food surfaces. So what did we find? In this section, I'll share the outcomes data from our IAQ monitoring. 33 of the 36 recruited childcare centers completed all components of the project. The map on the left-hand side is showing who participated. So the pink circles represent family centers caring for 8 or fewer children, and the orange circles show the group centers that care for more than 8 children. And those circles are superimposed over the county map that shows household income. So the lightest color green is showing the smallest household income, and as the green color gets darker, that's showing the areas where household income gets higher. The right-hand map is showing the same income map, but the circles are illustrating where our instructors were participating. So the blue circles show the Fight Asthma Milwaukee instructors from our local nonprofit. The green circles show the UWM nursing student instructors, and they taught in teams of 2. And then the orange circles are showing the community health workers from the Medical College of Wisconsin. Here is a visualization of the PM 2.5 data. On this chart on the left-hand side, each number is representing a different childcare center, and the colored bars or rows coming out from those numbers are showing you the amount of PM 2.5 that was detected. I'm going to use this graph to show the thresholds that were chosen. The first PM threshold was from the Environmental Protection Agency. It's a 35 microgram per meter cubed, 24-hour average. And there is a World Health Organization threshold, which is more conservative at 24 micrograms per meter cubed. We can also show this kind of reading for the carbon dioxide levels that were found in each of those childcare centers. And we used a 1,000 part per meter threshold set forth by ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers. And then the third set of data was from the volatile organic compounds for each of the centers again. And the threshold chosen was 300 parts per billion. The collected data was averaged and is shown here by hour of day. So here's the PM 2.5 thresholds, the carbon dioxide threshold, and the VOC threshold. And you can see that for carbon dioxide and volatile organic compounds that we started to see exceedances of those thresholds toward the end of the day. The data was also averaged by day of the week. So for PM 2.5, we did not see any exceedances, but for carbon dioxide and volatile organic compounds, we saw exceedances towards the end of the week. So levels were rising by the end of each day and were rising also by the end of each week, which led us to re-examine the data just during occupancy hours. So this graph is showing IAQ levels during occupancy hours, just when the businesses were open. And for all 3 IAQ factors, we saw exceedances. So PM 2.5 exceeded thresholds 8% of the time. Carbon dioxide exceeded thresholds about 37% of the time. And VOCs exceeded thresholds about 31% of the time. Our educational program did not lead to significant changes in reported cleaning behaviors or IAQ factors that were being measured by the FUBAT, even though on the satisfaction surveys from the Green Cleaning program, participants were reporting that they really did feel like they were going to change their cleaning behaviors. So you can see these 2 sample questions listed here. Everything coded in green, dark green, and light green is showing strongly agree and agree. So they are strongly agreeing that they're going to change how they're cleaning, and they are strongly agreeing that they would recommend this class to others. Also in that survey, participants were asked to rank obstacles to changing their behavior, and there were some highly significant differences between the licensure groups. First, in time, that was definitely the primary obstacle for small family centers, and for leadership, which was the primary obstacle for large group centers. To summarize results, we found carbon dioxide and volatile organic compound levels increasing by late afternoon and towards the end of the week. Looking at operational hours, we found IAQ exceedances for PM 2.5, VOC, and CO2. The education we provided did not significantly alter cleaning behaviors or IAQ, but childcare staff education is feasible and was well accepted. A few lessons. We think individualized, longer-term programming may work better than a single curriculum intervention. The high carbon dioxide levels we found suggest poor ventilation. So support for retrofitting ventilation systems or recommendations for opening windows when IAQ levels rise could be helpful. We also found that group centers tend to hire cleaning companies. So support and education could be directed to those cleaning companies and not just childcare staff. Based on the success of that pilot project, our team is excited to announce new funding from the Advancing a Healthier Wisconsin Endowment. The project should have started already, but is being delayed mostly because of the COVID situation in our community. We would like to have business as usual happening in childcare centers, so we're hoping that by fall we will begin the 3-year project and the process of recruiting 50 more childcare centers to work on this issue. We're going to be able to buy improved IAQ monitors with better technology, and we're going to recruit families whose children are being cared for in those childcare centers so that we can try to link up reports about those children's respiratory symptoms with the IAQ factors that we're measuring to see if there's an association between the indoor air quality levels and the respiratory symptoms of the children. We're going to expand our support to be longer than 4 months with all of the childcare centers, and we're hoping at the end of this 3 years we will have some recommendations for policy change regarding indoor air quality and what best practices might be recommended for childcare centers, at least throughout our state. It really takes a village to do this kind of community work. So our sincere thanks goes out to this long list of folks on the slide, as well as all 36 childcare centers that worked with us really diligently to try to get some baseline information about indoor air quality. If anybody needs to get a hold of any of the project leaders from this program, those emails are listed here on this slide. I'm going to end with this slide full of references that we used to inform our pilot study. I want to thank everyone for tuning in today. I really appreciate the time you spent with me.